it is still kind of hardly recognized as a sickness, because it's just like people, when you look at you swollen with hives, with sort of hives, and like they look like bruises. My name is Elena. I'm 50 and I'm actually a teacher at the high school. I teach English, and I'm from Milan, Italy, born here. And I'm also the president of the National Association for the Cure and the Research of Urticaria. When I was actually diagnosed with urticaria, it was something like 10, 12 years ago. But as a matter of fact, I have been suffering from it for more than 20, 22 years. And unfortunately, the path to diagnosis was very, very intense and painful, because I went through several doctors and that were allergologists or dermatologists. But back at that time, they were not into urticaria. And therefore, it took me a while. Unfortunately, it was very, very hard going through different treatments before getting to the final international guidelines that gave me, great health and gave me the opportunity to be here. Well, at the very beginning, I went actually to a dermatologist because, of course, the hives and all the suffering was expressively, shown on my skin. But going through the different clinicians that I mentioned before, I understood, and even actually getting a little bit more clinical information over internet and over medical books, I understood that it was a little bit deeper. Even because throughout these initial years, it was not just like related to skin, but it was a general, feeling bad, and a general getting harsh and harsh, actually more and more harsh. And the problem was even related to the fact that I started being weaker and having fever. It was really hard, to go through the working life that all of us fortunately has. And so I went through the opportunity to look for immunologist. But again, back at that time, so if we think about, 10, 15 years ago, immunologists didn't even exist, or at least they were not, well known by patients, by the community, as a matter of fact. But I came across actually one of them in one of our big hospitals here in Milan. And he was even actually studying urticaria. So he had just got a degree, he's a medical degree studying urticaria. And that was my actually safety. One of the trouble that I came across throughout my terrible path through diagnosis was related to the fact that doctors didn't believe me any longer. Even if I had actually taken pictures, I had, written a diary, and I was very precise. I was really precise and very kind of scientific, trying to be just to help myself, but to help clinicians to understand what was going on. But there was a pretty good number of them that told me that it was something like psychosomatic, psychological, you are nervous, you are, whatever. Yeah, for sure, I couldn't sleep, but, I hardly had a life. And so I can understand that probably I was even actually, going through a breakdown. I don't hide it. When you're sick and you don't find a solution, that's pretty normal, I suppose. So when I got the chance to meet these clinicians, as a matter of fact, I just embraced the experimental, treatment, because I had gone through so much that had actually taken me, collateral effects, and really, put me in a worse and worse, daily, life. But I'm a very lucky human being because I have a wonderful family. And I think that family and caregivers in general are fundamental for every pathology. But I do really have to say for our pathology in a particular way, because it was not, and it is still kind of hardly recognized as a sickness, because it's just like people, when you look at you swollen with hives, with sort of hives, and like they look like bruises. I got like an alien. But if it hadn't been for my husband, my son, my parents, and my sister, just like being around me, support me, believe in me. Looking back, I had wished to have all those doctors I went through told me, we don't know what you have. Because I think that it's very important. Not all, nowadays, doctors must be specialized, because we are such complicated, social animals in that way. And therefore, the thing is, okay, if a doctor doesn't know something, that doesn't mean that he or she is not great. On the contrary, say, hey, I don't know what you have. I understand that it's serious. Let me ask the team, or let me ask other people. So probably I would have gone through, the allergologist, immunologist. Okay, so this double thing, kind of earlier. Okay. And instead of, giving just like treatments just because you're in front of a doctor, I would have, said, okay, with your diary, okay, can you please take notes of this or that? Or I would have actually asked to pay a little bit more attention to details, to pay a little bit more attention to pictures, to listen to patients. I would have had somebody say, okay, translate me things. Okay, I tell you how I feel, translate me things. Now, thanks to what you're doing, what we're doing as an association, I mean, it's important to have a network of people that at several levels can help patients to get to diagnosis, see? But at the same time, as I was telling before, even patients have to study, have to be aware of what they're doing, because the more precise they are, the better it is, the earlier they get a diagnosis, and in a shorter time they get to a really healthy state of mind and body at the same time. So network. I was lucky because I always had people that supported me, and I shared my pathology. As a matter of fact, in Italy, there were a couple of associations, but they were focused much more on asthma, because no wonder asthma, has been, treated and studied for longer times. And I tried to contact them because it was kind of, I kind of allergic thing, kind of, confused to my no knowledge back at that time. And they told me that, they had some cases of urticaria, because asthma and urticaria, as you probably and as you surely know, sometimes has got, some links. And as a matter of fact, the treatment itself comes from asthma. But there was a huge gap, and there was no support. So they just told me, oh, unfortunately, there are no cures. But, if you want to be a part of an association, I think that an association of Patients for Patients does have to help you out. And therefore, I decided just to create it. It's so incredible because we have a scientific board. And the scientific board has actually the most important people in terms of urticaria. Even they were actually writers together with Dr. Maurer and with all the team in Berlin of the international guidelines. We went to Rome, we went to the Ministry of Health, and we battled, even legally, I'm telling you. We went through, legal things, and we got the treatment in Italy. I would suggest them to look for patients associations, first of all, look for Urticaria Association and hospitals. Okay, for example, if you go through a Google search, look for official sources. Not to just like write over a blog, hey, I got urticaria, I share pictures, and have, just like replies, responses from people. Look for the associations. I mean, there are associations. Look for urticaria centers. Look for UCare centers, because they can help you out.